Hello and welcome to the 2019 Education Minnesota ESI Member Benefits Medicare Made Easy webinar. My name is Gretchen Huber-Schomer and I'm a benefits specialist with Minnesota Health Insurance Network. Minnesota Health Insurance Network is an independent agency that manages the Education Minnesota Group Medicare plans. Today we will discuss Education Minnesota and Minnesota Health Insurance Network and how we are connected, the fundamentals of Medicare, then we will talk about the Medica group plan offerings, the UCare group plan offerings, and last, the Humana group plan offerings. At the end of the webinar, you are welcome to type in any questions that you might have, or you are always welcome to contact me at your own convenience. Minnesota Health Insurance Network is an independent agency with over 25 years of experience in the health insurance industry. We are located in Burnsville, Minnesota. We represent all of the major healthcare providers in Minnesota. We help seniors shop to better understand their options with Medicare and ways to supplement their coverage. And we offer exclusive group Medicare benefits to Education Minnesota members. As you can see on the screen in front of you, we do work with all the healthcare providers. However, the Education Minnesota group offers plans from 3 insurance carriers. So if you do have questions about plans from other carriers, please feel free to contact me for further information on those. Now let's talk a little bit about Medicare. As you can see in front of you on the screen, this is a picture of what your Medicare card will look like. If you will be turning 65 and you are drawing Social Security, you will receive this card in the mail automatically within the 3 months prior to turning age 65. If you are not drawing Social Security and you will be turning 65, you will want to go apply for your original Medicare Part A and Part B at the Social Security office, or you can go on to the website www.medicare.gov to apply as well. You can see on the card it's going to have your name, a Medicare number, and then your Part A and your Part B effective dates. So what is Medicare? You might ask. Medicare is a government program developed for the nation's aged to provide financial benefits for health-related occurrences. It covers a range of Medicare-approved medical services such as inpatient stays, hospital stays, physician or outpatient visits, and your prescription medications. How do you qualify for Medicare? You qualify for Medicare in one of 3 ways: when you first turn age 65, or if you have become permanently disabled for 24 months, or if you are diagnosed with end-stage renal disease, which is also known as kidney failure. How is Medicare divided? Well, original Medicare, which is the coverage you get through the government, is divided into 2 parts. You have your Part A, which covers your inpatient hospital stays. And with that, if you only had original Medicare coverage through the government, you would have a deductible that you would need to meet each year before your benefits would start. Your Part B covers your outpatient or your physician services. With your Part B, you do have a monthly premium you do need to pay to the government each month. If you are drawing Social Security, it will be taken out of your Social Security automatically. If you are not drawing Social Security, you will be billed for your Part B monthly premium quarterly. With your Part B, you also have a deductible that you need to meet before your benefits begin. And once you meet that deductible, you have a co-insurance that you need to pay for your services. With original Medicare, there is no maximum out of pocket, so you will always continue to build up your medical bills. Another part of Medicare is called Part C. Part C is also known as a Medicare Advantage plan. Medicare Advantage plans combine your Part A and your Part B, your medical services, and it also includes your Part D, your prescription drug coverage. Part D, your prescription drug coverage, you can also enroll in a separate plan for your prescription medications. Let's talk about the costs of Medicare. Your Part A is at no cost to you as long as you or your spouse has worked 40 quarters in your lifetime. Your Part B is a monthly premium. In 2019, the monthly premium for new Medicare beneficiaries is $135.50. However, the Part B premium is based on income, and Medicare looks at your income from 2 years prior. The income guidelines are: if you are a single tax filer and your income is over $85,000, you will have an additional premium above and beyond the $135.50. If you are joint tax filers and your income is higher than $170,000, then you will also have a higher monthly Part B premium. Now, these premiums can change because, like I said, they do look back at the previous 2 years. So if your income has changed each year, then your Part B premium can adjust as well. You are always welcome to contact Medicare to appeal your Part B premium to see if you are able to bring that down if you have a different lifestyle than you did the 2 years prior. Your Part C is going to be optional because it's going to be based off of the plan that you decide to go with. And your Part D is also going to be optional because that's going to be based on the type of plan that you enroll in for your prescription medication coverage. Let's talk a little bit about the different enrollment periods. The initial coverage election period is the enrollment period when you first turn 65. You have a 7-month window. You have the 3 months prior to your 65th birth month, the month of your 65th birthday, and the 3 months after your 65th birth month. This is when you can apply for your Part A and your Part B through Social Security. Then there is the annual election period, which is also known as open enrollment. This takes place each year, October 15th through December 7th. Open enrollment is a time for Medicare beneficiaries to change their plans if they choose to, and then their new plan will begin on January 1st. And there's also what they call special election periods, and those are for special circumstances, such as when you retire and you decide to come off of your employer plan and start Medicare, or if you decide to relocate or move out of your service area. However, you are able to enroll in an Education Minnesota sponsor group plan at any time. Now let's talk a little bit about the different types of Medicare plans that you can enroll in to fill in the gaps and holes of original Medicare. The first type of plan we'll talk about is a Medicare supplement plan. The Education Minnesota group plans do not offer any Medicare supplement plans to enroll in, but we will give a short detail of what those plans consist of. With Medicare supplement plans, Medicare is the primary payer. So Medicare pays first for your Part A and Part B, and then your insurance company will fill in the gaps and holes. Being on a Medicare supplement plan, you are usually able to see any provider in the U.S. that accepts Medicare. If you decide to relocate or move, you are able to take Medicare supplement plans with you when you move. Medicare supplement plans only cover your medical services. These do not include your Part D or any coverage for prescription medications. You would need to enroll in a separate Part D plan if you needed to enroll in coverage for prescription medications. Now let's talk about the cost plan. Cost plans are available in 21 counties in the state of Minnesota. Cost plans are also known as a type of hybrid plan because Medicare is the primary payer for your Part A services and your insurance carrier is the primary payer for your Part B services. With cost plans, you're going to receive your best benefits when you stay in network in your service area. However, when you are out of the service area, you are able to see any provider that accepts Medicare for your in-network benefits. With cost plans, you are able to include your drug coverage or just take the medical part of the cost plan. However, if you live in a county where you need to enroll in a cost plan with the Medicare plan option, you do not have the option to not take the drug coverage. These plans with Education Minnesota group plans have the Part D coverage included in all of the plans. And the last type of plan we'll talk about is a Medicare Advantage plan. A Medicare Advantage plan is where Medicare assigns the rights to the insurance carrier. So the insurance carrier is the primary payer. They now take on all the risk of your medical bills. With Medicare Advantage plans, we do recommend that you see the providers that are in the plan's network to receive your highest level of benefit coverage. Travel benefits vary by plan, so you always want to take a look at that plan to make sure it's going to cover you for where you're going to want to be traveling. The Medicare Advantage plans that we offer through the Education Minnesota group plans do include your prescription drug coverage. Now let's cover the Part D and the coverage gap. With your Part D coverage for your prescription medications, there's going to be 3 different levels of coverage. The first level of coverage, stage 1, is when the insured is going to meet their deductible, so they will pay for their medications until they reach their deductible for the Part D. Once they reach their deductible, if they do have one, they will then pay their co-pays or co-insurance until the total retail cost of the medications equal $3,820. And that's an annual cost. So that means between you and your insurance company, you've spent a total of $3,820 in prescription medications. Once you've reached that, then you step into the next stage, which is stage 2, the coverage gap, or also known as the donut hole. Once you're in stage 2, then the insured is responsible for 95% of the cost of their brand drugs and 37% of the cost of their generic drugs until they reach their true out-of-pocket cost of $5,100. Now, the true out-of-pocket costs are what you've already spent out of your own pocket for your deductible and your co-pays and co-insurance in stage 1, and then what you spend for your brand drugs and your generic drugs in stage 2. However, the nice thing is that when you're in stage 2 and you're responsible for 95% of the brand drugs, you really are only going to have to pay 25% co-insurance out of your own pocket because the drug manufacturers give a discount. You still are responsible for the full 37% of the generic drugs. But once you've reached that $5,100 in true out-of-pocket costs, you step into stage 3, which is also known as the catastrophic coverage level. Once you're in that stage, then you will only be responsible for $3.40 copay or 5% coinsurance on your generics, whichever is greater, and an $8.50 copay or 5% coinsurance on your brand drugs, which is ever greater. There is no maximum out-of-pocket on your Part D plans. You will continue to pay your prescription medication costs. And this is for an annual term. So January 1st, the clock resets for your medication costs. So you may want to ask yourself what you should look for in a Medicare plan. The first thing that we advise is that you take a look at your medications and make sure that they are on the formulary of the plans that you are looking at. You want to take a look at the costs, the out-of-pocket costs for those medications, and what the monthly premiums will be for you. You want to take a look and make sure that you're going to be having your doctors or your health system covered by the plan, as well as any hospitals or pharmacies that you use. And then you might want to think about if you've been with that insurance carrier before, were they dependable and reliable? Did they have good customer service? Were they friendly? Did they help you with any type of issue you may have had in the past? In front of you is some resources that we put together. If you have any questions, your Social Security Administration phone number is in front of you if you need to call there to set up an appointment to go in and apply. You may also go to that website, www.medicare.gov, create an account and apply for your Part A and your Part B that way as well. You can always give me a call with any questions that you have at the phone number there on the screen in front of you, or you can visit our website, www.educationmn.mnhi.net, to view all of the different plan options, the different ways to enroll in the plans, and we also have a nice spreadsheet. It's called an overview of all the plans side by side to compare to see what plan might be the best option for you.